Hi beauties, thank you so much for joining me again on my channel. Today we're doing a follow-up procedure for Jamie. Jamie was our client who we did 2 weeks ago. We did the, if you watch the full procedure tips and tricks for Hyaluron Pen, then you'll be able to see the full procedure that we did for her. I left a lot of tips and tricks on that video. I will do the same today, just focusing on slightly different things. So I know that a lot of people struggle with angles and product loss and obviously therefore retention, lumps, bumps, etc. So just to recap on that during today's procedure, and what's quite exciting is we're doing an extraction for a little bit of superficial product. It happens very rarely. I was very glad that it actually happened today in the procedure, so I can show you on the video how to extract it should that happen to you. And if you subscribe, you'll be kept informed, because after 2 weeks, in 2 weeks time, we're going to be doing her third treatment, and I'll be able to post photos of her retention. So I think that that's a very good motivation for you to subscribe to my channel. Hope that you enjoy this. First, we remove the numbing cream. I left the numbing cream on for 25 minutes. This is not essential, but this way my clients don't feel a thing. Then you'll see that there is a small image in the video clip. That is just her initial before photo and her before today's procedure photo. So that is after, the second photo is after one treatment, 2 weeks, or actually about 3 weeks later, to be honest. I think it's just a little bit more than 2 weeks. So yeah, that just gives you an idea of the type of retention you can expect after one treatment. Remember that this is not a treatment that is only a once-off procedure. You do need a layering phase, so that means that you're always going to be committing 1 to 3 treatments to get your initial results. Remember that when we take shots, we do pocketing. Pocketing means that I'm just squeezing the skin a little bit to create a soft surface, so like a cushioning effect, and that just means that my product won't be pushing against a hard surface like a bone or teeth or gums. Also, my pressure is very firm, but I am not pushing extremely hard against her lip. Here's just an example of the mapping that we used for her. This is not, I used about 0.7 mils of the serum. So this is not an exact shot for shot map, but it just shows you more or less where I placed my product. The only difference between this treatment and her previous treatment is she had quite a nice pout effect when she came back now. So I have used slightly more of my shots towards the inner side of the lip and slightly less on the border of her lip. But with that being said, remember to stay away and out of the wet line. So always work as far out of the lip as you can in terms of staying between the wet line and the vermilion line. So still inside the lip, but towards the vermilion line rather than towards the wet line. And that should just help prevent lumps and bumps. Here you can also take note of my angle. When I work on the vermilion line, I tend to work at a slightly more 90 degrees angle. And then when I'm doing the product in the lip, then I will start moving my device to a slightly more 45-degree angle. You'll be able to pick it up throughout the video. I do adjust the angle as I feel it's necessary depending on where I'm trying to place my product. This varies slightly, but usually if I'm working on the top lip, I'm pointing or angling my device slightly upwards towards the nose. And if I'm working on the bottom lip, I'm angling my device slightly downwards towards the chin. Also, always remember that after your shot, you need to wait a few seconds before pulling away your device. If you release the product in a split second or a second you remove your device, you're going to get your product to be too superficial on the skin, and you're going to get product wastage. It takes a few seconds for the product to penetrate. So I normally release my product, I do a light massage with my device, and I'm waiting about 5 or 10 seconds. I can very often hear my product penetrate through the lip. The thicker the viscosity of your serum, the longer you're going to have to wait for it to penetrate properly. Purely for the sake of keeping this video on the shorter side, I have cropped out odd shots. So if I've done 1 or 2 shots in an area, I've cropped out more, just that you're not watching this video for the next half an hour of your life. Remember to keep the area dry using a dry tissue, because if your device slips while you're taking a shot, which is something that can happen quite easily, obviously that can cause more bruising, it can cause more swelling, and it can also cause superficial product. So keep the area. I have cropped it out in order, again, to save some time, but I'm almost drying the lip and the ampule nozzle almost after every single shot. I'm working with a high viscosity filler at the moment, so I keep my shots at 0.02. Where I'm working right now, there I sometimes will reduce it to 0.01 just because there's more blood vessels and there's more risk of bleeding and swelling and therefore bruising. If you have a lot of experience, then it doesn't really matter what you do, because you will be able to angle your device properly, use the right amount of pressure, get minimal swelling, minimal bruising, all due to the fact that your technique is what it should be. And here is an example of the angles that I use while I'm working on certain areas, as we discussed earlier on in the video. Okay, I think it's time for us to start chatting about that extraction of the superficial product. There are numerous reasons that can cause this, but it is usually going to boil down to your product was not injected properly. It is now too superficial. So that could be the angle of your device, the pressure that you're using against the skin, so not enough pressure, or too much pressure, so for example, not pocketing. So here, sorry, you can actually see it. I can push it, squeeze it, play with it, wipe over it. It's clearly there. I can't remove it. It's underneath the skin, but it's very superficial. It's actually creating like a little bubble, if I can call it that. So it shows me that it needs extraction. Okay, so what I'm going to do is I'm just going to finish the last few shots because I am almost finished with my procedure. Then I'm going to just reapply numbing cream. Now this is definitely 110% not necessary, but I really don't do pain and nothing, none of it at all, ever. So I'm going to reapply a tiny bit of anesthetic just to make sure that she doesn't feel a thing. I'm just going to leave this on for as long as it takes me to finish up her treatment. She is still not feeling my shot, so she really shouldn't feel a tiny little pinprick in order for me to do the extraction and a little bit of squeezing to get the product out. But again, like I said, I'm just on the, well, I'm overly cautious when it comes to pain, so I'll just numb her anyway. I would normally use a lancet, so obviously it'll come in pre-sterilized packaging, and I would use that just to create the tiniest of tiny little pinpricks on the little bubble exactly, and then I can just gently squeeze until I see that the product is coming out. As you can see, I did not have a little lancet to use, so I've just used the little needle that came in the filler that I used to actually decant the filler into my syringe, because I'm throwing that away anyway. There you can see I'm just gently squeezing, and you'll see that all the product will basically pop out of the area. I've done this in slow motion. I hope that it helps. There we go. Done and dusted. Client didn't feel a thing. Now I can just dry the area, and I'm going to start my finishing step, which is my massaging. If you have a little vibrating facial massager, this is most definitely an excellent tool to use. I don't have one on me, so I'm going to massage using my fingers with which is obviously definitely an essential step, with a little bit of arnica oil. Vitamin E oil also works really well, and I'll use my jade roller. I like using the jade roller because it has anti-inflammatory properties. I can also put it in a refrigerator beforehand, obviously occluding it so that it's not making contact with anything in the little medical fridge. But basically that'll cool it down, and that's also really a nice relief for the client, and also contributes to the anti-inflammatory properties of the little tool. Great, thank you so much for watching. I hope that you learned something new. I hope that you enjoyed it. Please like, subscribe, comment, share. Any feedback is welcome. I really do appreciate comments, and I love responding, so please do ask me any questions that you might have. Premier Beauty Academy have instructors all over South Africa and Namibia, and we're always, any of us are happy to help if you've got any questions regarding permanent cosmetics, Hyaluron Pen, microneedling, BB Glow, lash lifting, plasma pen, we do it all. So only happy to help.